Ever wondered about some of the most unusual ways you might get pregnant? We've all heard those crazy myths and rumors, but how much truth is there to them? Today, we're debunking myths and answering your top questions about pregnancy risks. We'll tackle those awkward questions you might be too embarrassed to ask your doctor, breaking down the science in a way that's easy to understand. Let's get started. All right, let's address the elephant in the room. Can you get pregnant from swallowing? The short answer is a resounding no. And here's why. For pregnancy to occur, sperm needs to meet an egg. That happens through sexual intercourse, where sperm deposited in the vagina travels up through the cervix to the fallopian tubes, where fertilization can take place. Your digestive system, on the other hand, is a completely separate system. When you swallow, anything that goes down your esophagus ends up in your stomach, where it gets broken down by stomach acid and digestive enzymes. Think of it like a separate highway system. Sperm swallowed would be heading towards your stomach, not your reproductive organs. Think about it this way. If swallowing sperm could lead to pregnancy, wouldn't every guy who accidentally swallowed some during oral sex be at risk? It's just not biologically possible. Now, while we're debunking this myth, let's emphasize the importance of sexual health education. Understanding how your body works and how pregnancy actually occurs is crucial for making informed decisions about your sexual health. Remember, knowledge is power. Don't rely on rumors or misinformation. If you ever have questions about sex, pregnancy, or contraception, reach out to a trusted healthcare professional for accurate information. Okay, so we've established that swallowing can't lead to pregnancy. But what about French kissing or oral sex? Technically, there's a highly unlikely but still theoretical possibility of sperm finding its way to the vagina during these activities. Here's how. If semen is present in the mouth and then comes into direct contact with the vaginal opening, there's a minuscule chance that sperm could travel up the vaginal canal. However, this scenario is extremely rare and would require a very specific set of circumstances. Think of it like this. Imagine trying to win the lottery. It's technically possible, but the odds are astronomically against you. Similarly, the chances of getting pregnant from French kissing or oral sex are incredibly low. However, it's always better to be safe than sorry, right? If you're engaging in oral sex, using barrier methods like dental dams can significantly reduce the risk of any unwanted surprises. Dental dams are thin, latex sheets that act as a barrier between the mouth and genitals. Think of them as condoms for your mouth. They prevent the exchange of bodily fluids, reducing the risk of STIs and that incredibly unlikely chance of pregnancy from oral sex. Remember, practicing safe sex is always a good idea, no matter the activity. Using barrier methods like dental dams adds an extra layer of protection and helps put your mind at ease. Let's talk about another common question. How effective is the pull-out method, also known as the withdrawal method? This is where things get a little tricky. While the pull-out method is better than no protection at all, it's not the most reliable form of contraception. Statistics show that about 22 out of 100 people who rely solely on the pull-out method will experience an unplanned pregnancy within a year. That's because even before ejaculation, pre-ejaculate fluid can contain small amounts of sperm. It's like trying to stop a sneeze halfway through. Sometimes those little droplets escape before you can fully control them. So, while pulling out might seem like a good idea in the heat of the moment, it's not foolproof. If you're serious about preventing pregnancy, combining the pull-out method with other forms of contraception is a much safer bet. Think of it like layering up for winter. One layer might provide some warmth, but multiple layers offer much better protection against the cold. Similarly, combining methods like condoms, birth control pills, or IUDs with the pull-out method creates a stronger barrier against unplanned pregnancy. Remember, when it comes to contraception, consistency is key. Choose a method that you and your partner feel comfortable with and can use consistently every time you have sex. Now, let's address another question that often pops up. Can you get pregnant from fingering if semen is involved? Again, the likelihood is very low, but there's a theoretical possibility. Here's the deal. If fingers contaminated with semen come into direct contact with the vaginal opening, sperm could potentially enter the vagina and travel up towards the cervix. However, this scenario is highly unlikely, especially if thorough hand washing occurs before any contact with the vagina. Think of it like this. Imagine carrying a tray of delicate cookies. If you're careful and walk steadily, you're less likely to drop any. But if you're rushing and bumping into things, the chances of dropping those cookies increases. Similarly, careful hygiene and thorough hand washing significantly reduce the risk of accidental sperm transfer during fingering. However, it's always better to err on the side of caution. If you're engaging in any sexual activity involving semen, practicing good hygiene is crucial. Wash your hands thoroughly before and after contact with genitals, and consider using gloves as an extra precaution. Remember, even seemingly low-risk activities can carry some level of risk. By being mindful of hygiene and taking simple precautions, you can minimize those risks and enjoy a worry-free sexual experience. So, there you have it. We've debunked some common myths and tackled those awkward questions about pregnancy risks. Remember, understanding how your body works and making informed decisions about your sexual health is crucial. While we've covered some specific scenarios, it's always best to consult with a healthcare professional for personalized advice. They can provide accurate information, address your individual concerns, and help you choose the right contraceptive methods for your needs. Stay safe and make informed choices. Your sexual health is important, so don't be afraid to ask questions and seek guidance from trusted sources. Knowledge is power.